Councilman, you talked a little bit about just the inherent challenges of shelter exit. The affordable housing crisis is lost on no one. But Commissioner Banks, you talked a lot about just now about this interrelationship between how DHS and HRA are partners, both before the front door ever comes into play and then when people are in shelter. I guess one thing that I think we're all particularly interested in is from the perspective of where you have leverage with vendor contracts, either with back to work contracts or Commissioner Taylor in the case of vendors that are managing your shelters on individual side or family side. What can we look for that would demonstrate changes in the way that you're administering city money? And in turn, what can we see as a different outcome? So average length of stay is 430 days. It doesn't look like employment is really actually the thing that's moving people out one way or the other on the family side. Can you give us some examples about what's actually going to happen with the money that you manage that will change the way that you'll see outcomes either that look like they're coordinated across your two agencies or individually? And here, to some extent, Commissioner Taylor, I'm talking about what's actually different for a family in shelter. What is the vendor going to be held accountable for now that they weren't held accountable for before? And I guess, Steve, the same on your side.
Well, I'll dive in on that one. How's that? I mean, a lot of this will really have to await the promulgation of our employment plan. It's going to be submitted for public notice and comment. People have an opportunity to comment on it. This isn't going to be your only opportunity to now to hear what it's going to be or later to ask questions.
Nor is this a council meeting.
That's true. And I'm sure we'll have a council hearing on our employment programs as well. But I think that the key change that we're going to be able to make immediately is getting away from the one-size-fits-all. There are vendors that have contracts. There are limitations on what we can do in terms of changes in the short run, but the employment plan is certainly going to articulate what our long-run range goals are. That is aimed at keeping people from getting into the shelter system, but I think the partnership between DHS and HRA is obviously, look, we have vendor contracts that are serving the same population that are being served by other contracts in terms of employment assistance, and we have to have better coordination. There's a lot of great data out there in terms of place-based employment training and place-based employment success, and to the extent that we've got people that are HRA clients that are also DHS clients, we have the opportunity to be more coordinated in the delivery of employment-related services.
So Eric, the answer to your question really lies with what I had referenced in terms of the model of practice. And one stark reality that I encountered when I first came to DHS was that our real measure of success across our provider network is how many placements they can actually make, right? And we say place, 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 place. We measure you by it. On our single side, we actually had a performance, a PIP in place that would incentivize in some ways, or that would penalize if you fail to meet certain targets. What was not supporting kind of the discussion around placements and permanency outcomes was really how do you go about placing, right? The conversation was lacking in terms of what suggestions can we as a contracting agency provide to you, what model of practice can we give you to support your efforts to find housing or to help clients overcome their barriers to housing. So thinking about if there's a model of practice and then delivering it and then training to it and then having in place within our system some quality assurance measures that would then support and provide TA to our providers around how they're actually doing the work that they're doing is something that we're committed to bringing into the system at this point because it didn't exist. At least I didn't see it when I was there. And it really does call for us to put in place systems within the organization and throughout our network that will support practice and that will support outcomes and that will help the providers to achieve the goals that we're calling for them to achieve. So where do we start? We start by looking at those providers who have their own models of practice. We start by looking at those providers who have best practices, some bright spots, and to think about ways in which we can capitalize on that and then bring it to the fore for all of our providers, right? Again, I think that some of this work may have been thought of, may have been begun in the last administration, but it's our commitment to actually see it to fruition in this one.
So from the perspective of just, let's start with shelter avoidance and then go into for folks that are actually in the system. If you were to wave your magic wand, any of you, and since the councilman sort of urged us to think about the fact that resources are going to be flowing, which hopefully someone will write about that. What's the lever you want to act on that you think is the most impactful, whether or not it's your agency or not, that's actually going to have a real tangible impact on reducing the flow in? And so if the answer is let's go after the affordable housing crisis, we're all in, except for it's going to take a while. So in the next 12, 18 months, what does that look like from your agency's perspective about what's the reduction?
I mean, look, what I've learned in the last 9 weeks is that there are a lot of things you can do that are relatively below the radar screen that have a huge impact on lots of people's individual lives and that are a piece of the puzzle. I'll give you an example. I don't know how many of you are steeped in each of the numbers that our welfare centers, or I guess job centers, are assigned these days. You can see when I started practicing what they were called, but I think I like the fact they're called job centers because it really keeps us focused on what we should be doing, which is to getting people connected to employment who can work. But Center 71 was one of the more notorious programs that we ran, in which it's basically people were sent there and sort of just on a treadmill, and it was only generating a lot of state fair hearings that now subjects us to potential $10 million in penalties for these unnecessary hearings. And it was a real negative for clients, and it was leading to ultimately not just sanctions, but full case closings and a driver potentially of that 1 out of 10 that I talked about on our side, or the 23% on the DHS side in terms of the group of people applying for shelter. So we closed it down, and we replaced it with, it's being piloted beginning this week, and it'll be fully effective during June and July, a place to centralize the issuance of rent checks, to stop the traffic to the centers with people saying, where's my rent check, where's my rent check, where's my rent check? One of the first things I heard from the judges and from the landlords was, if you do anything, figure out a way to get the rent paid in a more timely fashion. And by the way, they pointed out to me that we should pay not based upon order of when we got the application, but on what the pay date is in the stipulation of the judgment, which seemed like a pretty basic thing to do. So we eliminated one really negative program that's producing some numbers of those 1 to 10s, and we replaced it with a real a program that's going to have a positive impact on what goes on in housing court and the repeated adjournments because HRA hasn't paid, and so on and so forth. So one might say, well, that's at the margins, and the crisis is so big, and it's over 50,000. But I want to emphasize, it didn't happen overnight that we got here. And each one of these little pieces that we have to change, we have to spend the time to change them. And we should keep focusing on the larger things and all the larger things that are out there. Mm-hmm. But in the end, our clients experience our agency on a day-to-day basis. And so being able to make some of these day-to-day changes that previously maybe we all thought you couldn't make in 9 weeks are part of the solution, I think.
Do you think that an overarching issue for clients that are in the system boils down to the fact that they interface with a lot of different systems? How much do you think that plays out to being an issue? Because, I mean, in a second, Commissioner Taylor, I'm going to want to ask you about some of your thoughts about the Dasani article, not about the article in specific, but atmospherically what it sort of brought out in the city's perspective about homelessness. But Steve, do you have a sense about that?
I think that when agencies act in silos, that is the way the clients experience it. But when agencies act together, they experience that they have the city behind the scenes saying, well, no, why don't you deal with it and we'll work together. And that's what HRA and DHS have been doing over this last period of time, which is sometimes it's case by case, sometimes it's issue by issue, taking a more collaborative approach. And I think ultimately we have to create for our clients a no wrong door experience. And in my time representing clients for a long time, that's, I think, what has been a big problem. That it's someone else's problem, it's DHS's problem, so HRA doesn't have to really deal with it. And I think to the extent that we take responsibility for the clients or the clients of the city, and there's no wrong door, we'll be a lot better off in the end with this.
Commissioner?
So that's the focal point of this administration in terms of how can we as a city system look at all of the work that's being done by all of our agencies for clients who are in shelter. And our Deputy Mayor, Barrios Paoli, is really intent in terms of having us do that. So by way of her convening an interagency task force to understand how are decisions by other agencies, those that were articulated by Commissioner Banks and other city actors, influencing or feeding the homeless system, right? So I know that if you evict something as simple as evictions from NYCHA, right? And considering, well, if clients are getting evicted from NYCHA, if there's a way to actually prevent them from being evicted, then we can prevent them from coming into shelter, perhaps, right? Looking at foster care, looking at children who are aging out of foster care. And to your question about the Dasani article and the reflections that we've had post issuance, it's really it's telling, right? There were a lot of systems that were involved in that family's life, and there were a lot of opportunities in the moment to really consider how could we have acted in different ways in order to have supported them, right? So there is something. It's having come from ACS, there's lots of stuff that we know about that people in this room know about. They have a housing subsidy, right? And some folks will say, well, you can never access the housing subsidy, but there are ways in which to actually access that housing subsidy for families who are child welfare involved. And that housing subsidy can be used to subsidize their exit from shelter. And there can be aftercare that's readily built into child welfare services that the family was already engaged in to help them stabilize in their new home, whatever that home would have been, that would have helped perhaps staved off some of the child welfare concerns that the family was experiencing. There were real opportunities for us to have worked together. And now that's what we're doing across the full health and human services portfolio.